how do we establish Lesvos as a global humanitarian tech hub, and why? Why do we believe it's possible? So from a context of saying market access, so what we're saying is people around the world have been developing tech solutions for the refugee crisis. Very few have succeeded, and we're saying, the argument we're putting forward is saying that most people that have developed the solutions have not tested them with the user, i.e. the refugees, and secondly, they don't know how to get access to the NGOs, to have a conversation on what the needs are of the NGOs. And so with Lesvos, with diverse stakeholders, we are saying we want to be the place where you test and implement these solutions, and looking at strategic partners through which we could accelerate that. So that's basically the context of our discussion. With that in mind, I would like to ask Daniel what your thoughts are on that, and what your potential partnerships would be on that value proposition.
Okay, let me start with a why. I think something which is need-driven, something that comes from a real need, is often a good starting point. Not always, but this is true for business. This is also true for the humanitarian sector. So if I know at the beginning of a project that there is a potential user or customer, this is always good. In the humanitarian sector, this is a little bit more complicated, because ideally you want to have a project which is developed, which is based on a need. You want to have it developed together with one of the drivers. Let's say we want to develop a new project that we identified which would be beneficial for migrants. Ideal partner would be an organization, an NGO, an IO, which is active in this field, has experience, can tell you what is something that could work, something that doesn't work. So you want to have co-ownership, co-creation of this product. If you do that, and when you basically even have a successful product, then something else comes into play. Yeah? Often it is that regulations, for example, anti-corruption regulations, prevent that when organizations who have worked and helped developing such product can be customers. So there's quite some difficulty, there's quite some disconnect of, on one side, being able to understand the real needs with a international organization partner, an NGO partner, and on the other side, driving it to something which can scale, which can be big enough that it is at least self-sustainable, not to say profitable, but at least self-sustainable. Why Lesbos is a good testing ground is, I think, because it has seen quite some crises in the last years. It is always good to learn from this and see what can be done even better when it was done. What can be basically appreciative inquiry, so what worked well, how can we learn from the things that worked well and build on that. And there is a big ecosystem of international organizations, humanitarian organizations present, which makes this learning easier than on many other locations. I don't say it's the only one where this is possible, but it's one possibility.
Thank you very much for that, Daniel. Next, I would like to ask, well, given one of the projects that were presented, DocU specifically, what was really fascinating over the last days was how the ecosystem, so Ms. Luvatidu, Dr. Ailidis, came on board to assist an idea, if you like. And we were so inspired by the work and the traction that they've gotten as a team, also, of course, with university being a partner, that we invited Ting to come, or we shared with Ting what is happening here, and the need, of course, for telemedicine. We know there's other stakeholders on board that are also looking at that solution. And so Ting came, spent a few days with us, and she's been in and out of meetings. So Ting, for your solution, for Click Medics to be implemented here, what would be required? What would you need to be able to prove that, and do you think it's possible? and what would you need from an ecosystem perspective to be able to help you implement ClickMedics with the team?
Sure. And just some background. So my company, ClickMedics, was actually founded out of MIT while I was a graduate student, going through the same experiences here. And for us to do a pilot, the idea was to use mobile phones to connect doctors to patients who are really hard to reach. What we had to do is actually go to sub-Saharan Africa, where there are underserved patients and very few doctors. But what's so special about lesvos is you have the ultimate beneficiaries right here, you know, within like 30 minutes away to the first camp. And on top of that, what we learned throughout these implementations is that the existing service providers, the current doctors, you know, likes of the UN, likes of other research programs, they have to be involved, they have to be endorsing, because ultimately care for health is provided locally. Eventually, the patient must go see the actual physicians. So what we've learned is that this, you know, co-creation process is so important. And the job of the pilot is to demonstrate the solution works, that patient would accept it, doctors would endorse it because it makes their jobs easier, and hopefully it may generate some revenue depending on what population we're serving, and that patients are actually getting better health outcomes. And further, because at the end, the government needs to endorse it as well. Government must see that the health system itself, in terms of total money spent on particular problems, whether it's medical supplies, health outcomes, also decreases. So absolutely, I think it's possible. We've done similar projects with similar profile of difficulties in other places. I think lesvos actually has advantages because we already have, you know, like Zoe, we have UNHCR boards, who's, you know, all represented here, and the student body. You already have an ecosystem, and normally this ecosystem, you know, would take about 3 years to find just the right partner. So thanks to Vasilis for making this all happen. And it's actually my second year coming to this conference, and I've seen so much work done building these partnerships. And now we're actually at the part, you know, to actually have solutions that can be implemented. So I think it's so exciting what we're about to do, and, you know, I'm really looking forward to making it happen here.
Thank you very much for that, Ting. Do you want to add something to that? Or?
Just want to add, so coincidental when I saw, Ting, your solution. We are currently working with quite a lot of different insurance partners, specifically around case management, specifically around how do you ensure that the right people get to the physicians at the right time. And there's a huge cost-saving component on that logistics, not getting everyone to the physician, that people that should not be there. And we've built a whole wearable strategy again around that can seamlessly touch your side of the technology fence, which is quite exciting. I think even beyond, this would be an ideal test case even for that, and then to use that to go beyond for other insurance plays and things. So it might even be a very, very good test ground exactly for that.
This is from the experts, right? And we're moving along to Boris, and it's an absolute pleasure and honor to have you here as well, Boris. Thank you very much for making the time available to come here. Boris last year was, we had a workshop the day before the event, and he spent the whole time there with us, listening intently, making his notes, and every time we've reached out to Boris, his door's been open to support us. So Boris, I know UNHCR Innovation are also doing unbelievable things in this humanitarian space. And so, you know, with what you, from last year, following on last year, and the discussions we're having, what you've heard here, what are your thoughts on how we could potentially collaborate better, and could we collaborate, and how do you see that process?
Well, thank you, Vasily. First of all, thank you for hyping up my profile. I think that, you know, I'm very grateful, but I'm just a regular foot soldier in the, with the UN Refugee Agency. But having said that, thank you for reaching out to the humanitarian community, and particularly as you're trying to develop this strategy to create a humanitarian tech hub on Lesvos. We feel and we agree with you that this has the right environment because tech needs to be informed. Tech is not my wheelhouse. Communications for UNHCR is something that I'm far more proficient in. But what we've seen throughout this emergency, not just on Lesvos, but across Greece and into the European Union, this exceptional situation which we had in 2015 and 2016 with 1 million people arriving. And now, post 20th of March 2016, when we have a more stable population on the mainland, but also on the island. So today, for instance, on Lesvos, there are about 3,000 refugees and migrants on the island. And you do have the humanitarian support system. Obviously, Greece has a stable government, it has stable institutions, it has the support of the EU. European Commission has come in with a lot of funding. A lot of the institutions that can support centrally from Brussels would also likely have a vested interest in building up something that takes the available, that we call actors, stage and cinema, but also humanitarian actors, because you have local authorities, you have the resource with the Aegean University, which is an incredible resource to have, with how much is the student body? 3,000 people or about? So a lot of, anyone know? Yes, on Lesvos. So you have this incredible resource of young, motivated individuals that can adapt to the new environment, that are technology users. I'm sure that amongst them there are many great ideas. And you also have the refugee and migrant community. Now, on the islands legally, because as you mentioned, there needs to be buy-in from the government, this is one of the limitations, perhaps, because the status of those individuals that are here is slightly different. Not all of them have the ability to work, for instance. But all of them do have the ability and the need for lifelong learning, for instance, access to education. So something that UNHCR has done through the innovations team and with SAP is, for instance, Refugee Code Week. We've rolled it out so far once. It happened in October 2016 in Egypt, in Lebanon, in Jordan, and in Turkey. And within 1 week, the aim was to train 10,000 refugees in coding, basic coding skills. They achieved that, and they're looking to repeat it again. And actually, SAP are looking into Greece, how they can interact more with, through UNHCR for humanitarian support. So you do have that element as well, the need for tech, but you also have the humanitarian community. And it's clear that tech needs to be informed. And why do I come back to this? Because throughout the emergency, we've been using platforms that were created by developers, by startups that didn't necessarily have the humanitarian background. So they didn't necessarily understand the legal repercussions of telling somebody how to cross a border, for instance. And there obviously are, especially if it's an irregular crossing. Or accessing a service that they don't have the right to access. So it needs to be informed by those that will use it. It needs to, obviously you guys know far better than we would, but it needs to look at the behavioral patterns of those that are going to use the product. So looking at, for instance, the provision of information, there's been a plethora of apps, of social media initiatives, of websites that have tried to provide refugees and migrants with information, but at the end of the day, because it's not updated or because it's incomplete, you see them coming again for a face-to-face with UNHCR, with an NGO, with the authorities, because they want a credible source. So working together with those that are providing humanitarian solutions, working together with the beneficiaries that will use the technology, and creating the co-working spaces that you have been talking about last year and this year again. I think that this is a great initiative, and as it comes together, it might look at resources that are beyond the island as well, because we have a population that is somehow in two different administrative realities. You have about 30-some thousand people on the mainland who were pre-20th of March, and many of them will be recognized as refugees in the country, which means that they will have almost equal rights to citizens, they will have the right to work, they will need to have access to education. And then you have the population which is on the islands right now, around 7,500 people, some of whom will be also able to integrate as refugees, recognized by the government. Others might need to go back to Turkey if it's safe for them. Others still are moving back to their own countries of origin through mechanisms such as assisted voluntary return. So you might have a population here that could benefit from training, from access to these co-working spaces, but you also might have a population that is in Greece, but beyond Lesvos Island, or in Europe, because if you're going to be building a humanitarian tech hub, I'm sure that you'll be looking for resources beyond Lesvos. And not to mention, and something that you've been alluding to throughout the sessions that I've at least seen, is the fame of Lesvos. The fame. And you know, sometimes, and this morning, my colleague and I, Leo Dobbs, who heads our communications department for Greece, we were talking with the hotel owner of the hotel where we stayed overnight, and he was telling us of Lesvos's image, the bad image of Lesvos, the notoriety of Lesvos, the infamous island. But at the same time, because so many people know where Lesvos is on the map, it might be the third largest island in Greece, but it's still a relatively small place. It is very famous. People know where it is. So yes, with the right connectivity, with the right people that are part of the team, as you mentioned, you know, you need to have the right team. You have the resources with the humanitarian community here, with the university, and with the refugees. So I applaud your initiative on behalf of UNHCR, and we're certainly ready to jump in within the limits of our mandate, within the capacity that we have. So thank you.
Thank you very much, Boris. Daniel, I see a big smile there. We've had a couple of discussions, and you know, being one of the supporters of G3ID and some of the initiatives that you've been driving and involved with, rather supporting in Geneva. Given of what you've heard here from Boris and in general what you've seen here, what are your thoughts in terms of, you know, next steps, or not next steps, but going forward? Is it possible that we could bring these stakeholders that have been trying to develop the solutions without the affected persons to come together and have a process where we could actually, or we've already got Ting as an example, but could we bring other stakeholders together and see what can work, given that we've got the support within the metrics of UNHCR, we've got your support, we've got an absolutely beautiful island with beautiful people. You know, so right now, I guess the economy is relatively cheap. You know, in October is still sunshine compared to London. So from that perspective, I'll stop selling. What is your thoughts on, you know, is there something in mind that you have that we could facilitate that kind of process with your innovation things that you're supporting?
You saw that big smile on my face because I couldn't agree much more. So yes, I totally share your feeling of that on one side you have very passionate people, individuals, NGOs, even IOs who try to quickly find a solution for pressing needs. On the other side you have some kind of siloing, so things are often done 3 times, 2 times. It is very, very hard, even when if basically a solution, or even maybe harder, if 3 good solutions exist from different organizations, maybe one is an IO, and another one is an NGO, maybe one is a private initiative, to bring them again together. And so exactly there I see that some kind of a co-working space, a co-owned model, a co-created model can add value. Because this allows still maybe that 2 or 3 solutions are developed, because nobody knows the perfect recipe, but it increases the chances that this products that are coming out, I call them products, because we see exactly the same kind of duplication of efforts, siloing also in the commercial world. So this is nothing very special to the humanitarian sector, but it also happens there. And so if one can learn directly from the beneficiaries, directly from the actors who are working with the beneficiaries, then the chances that the products, whatever it helps to make the humanitarian work more efficient, are higher. It's exactly the same what Manu was telling us for fully commercial operation. If you listen to your client, if you understand what your client wants, most probably you have a higher chance for success. Same, if you listen to your beneficiary, if you listen to who helps the beneficiary, your chances that something is more impactful is higher. mHealth is one of the topics where, for example, the humanitarian sector is a perfect test bed for trying out new methods. Just giving you one example where aggregation can help, where different organizations had mHealth solutions that were piloted, different organizations, I don't say no names, and now they come together and say, oh look, we are doing pretty much the similar thing, why should we do it 3 times? Let's sit together, define what our common needs are for this humanitarian mHealth solution, and it's, for example, about reducing child mortality by giving doctors and nurses a guideline just to follow basically the procedure which the state agreed to, so that doctors really can follow step by step and are reminded what are the critical points. In some contexts, the child mortality was reduced from something like, I don't want to lie with numbers, what I remember, from 17 to something like 2%. A tool that, now looking from a commercial perspective, when my child is sick in the night, even in a developed country, I don't have this luxury to basically go through myself through and understand, maybe more informed if I should directly rush to the hospital or if it can wait till tomorrow. And so I'm putting more risk to my child by bringing him to the hospital, maybe he gets another infection. So if I would have basically a similar solution available, I could do risk reduction, exactly what was mentioned. Insurances can be interested in that because it might lower my health costs.
Daniel, quick question and answer as well. On the specific one, I want to ask you, there's a lot of talk of bottom-up and grassroots, so from Geneva looking to focus on saying, well, let's get to the bottom, right, on the ground and see what the problems are. And so Lesvos is obviously on the ground. Maybe you want to just also let our audience know about the support that we have with the port and other potential areas that you see a potential direct link with Lesvos and Geneva. You can just maybe briefly touch on that.
Okay, so with the port, the humanitarian hackathon, I think Christina would be much better in the situation to say, but what my understanding is that we can help to identify needs from beneficiaries, from organizations who support beneficiaries, which have maybe a technology aspect, which have a technology challenge, use local student teams to maybe make a first assessment. If then some expert support is needed, either from a humanitarian side or from the technology side, bring this to Geneva, and then whenever a first prototype is ready, directly bring it to field testing, not wait long time until really following a lean model of business and prototype development, and directly with all partners involved, make field tests. So this is what I see for the port. For other initiatives, I think you mentioned UNHCR Innovation has a lot of programs where exactly bottom-up innovation is tried to foster. Many different other organizations having same initiatives, and we're starting to aggregate this so that with the means that are available, one can do even more. Just do a direct connection to a project that we listened today about mobile phone repairs. There is initiatives in Geneva and worldwide to understand from migrants and refugees, like we heard today, what are the tools that they really need, and provide them kits so that they can repair smartphones that are broken, tablets that are broken. Because there are skilled people often coming, as we heard today, who can do these repairs and then, for example, bridge the information gap that they would have otherwise. For example, if they have an interview and all the documents that they need to for this interview are on the mobile phone.
Thank you. Just from the port perspective, I just want to mention with our partnership and as a supporter, firstly, the hackathon solutions that are being worked on are open source, so it's available for everyone. But how we're looking to link is to at least one of our solutions here, one of the guys that pitched, to be presented to the team at Port and to work on that. And in addition, to invite at least one of the members as well to go and be there to give insights of on the ground. So that's a very exciting partnership, and thank you to Christina for being here as well for that. Then I want to quickly go to Rian. Rian, saying again, from a lesvos perspective, positioning it as a global hub and appealing to a global community. In the last 18 months, if I'm not mistaken, you've not been in a place for longer than 7 days. You've not had a holiday for the last 2 years. And you have taken time out to be here with us and share your views and your thoughts. And on top of that, you're also taking some time out. So if you can maybe just share some thoughts on that and any other comments you have on.
Yeah, I think I heard it here today as well when people said that the word refugee is stigmatized. And I just had this sense when I read the papers, and I constantly read the word refugees, I'm like, I just want to know what the person is behind this word refugee. Because I do think it can be someone that simply was in their job environment or with their family, and then the next day they had to run into an ocean or something, and then to find refuge. And I think, Vasily, it's much more that it's more about the human connection. It's to see to truly understand the need. You know, I need to see it for myself. There's no other way.
Thanks, Jan. I think Ting, what really stood out for me when you were talking about your application was how you are reducing health costs. You know, a lot of people, when they hear about technology, are sitting and saying, we're going to have to get rid of some staff. And so that would reduce costs as well, but just from a perspective of telemedicine, that, and especially from an island's perspective, if you don't have a specialist, arguably that patient would have to fly to Athens, the mainland. So if you could just elaborate more on some of the health costs that you've seen being reduced, especially in areas, I guess, like sub-Saharan Africa and other areas, and how you see a significant reduction in costs.
Sure. I think the problem of costs, comes from different perspectives. Places where the government or public funding pays for healthcare, the reduction is from efficiency. So in Botswana, where HIV is highly, highly prevalent, the cost is spent on flying the doctors around to the different states and provinces of Botswana. And just on the reduction of flying the doctors around, it's over $1 million per year saving that we were able to demonstrate. And if you look at more of a private pay market or an insurance paid market, the cost is in the misuse of healthcare systems. So going to the hospital when you have an earache or pink eye because you didn't know where else to go. I know in the US, just stepping in a hospital, it's at least $500. Here in a system like this, you are taking a spot away from someone else who really needed perhaps seeing a cardiologist or have a heart condition. So it's about using resources effectively, and obviously if you can optimize that, you're going to reduce costs dramatically. In the insurance market, when we look at even chronic diseases, and that includes mental health, things where you have to see the doctor repeatedly, that includes diabetes, nutrition, and all of that, daily activities. We're able to reduce the cost from a US number, 9,000 to 4,000. That's a 58% reduction. If you look at, parity in terms of dollar values, that's perhaps going to the right clinic instead of a hospital one time and getting the right medications and understanding, aggregation of demand from a community like the refugees or even the local Greeks. What are the public health interventions that can literally, one education program that can help the entire population, or awareness of where to go for something like a chronic disease, not the hospital, and making those locations like the Padi clinic, making that known as the place to go to instead of, by default, I need to go to a hospital if I have any problem. So those are the areas where we see huge cost reductions, and it's not about, looking at every detail. It's the 80-20 rule. You take the biggest cost, which is going to be hospital visits, cut that by providing an alternative that is much better, faster, and cheaper.
I think in terms of our solution, Vasily, I mean, you can think how if you do a case management like this, having a more continuous information stream from the individual, it's an extra context point. It gives you context, and also even at an epidemiological health level, you can very rapidly see when a flu, for instance, starts to grow within a population. So now you can, not even on the individual level, but you can at a whole population level say, this, I need to intervene now. This is the seriousness of intervention I have to do to contain this. You can determine how fast a vector can spread through a population, those type of things. And then you have your more chronic mental disease, to be able to see that someone is going into a depressive or into an anxiety episode, to react very swiftly there, can save tremendous amount of cost. To keep people out of the hospital after a complication, they have treatment, they can go into septic shock. We can very early on detect already when someone goes into septic shock. So instead of the normal using a thermometer-based method where you have 5-6 hours, if you do it properly, you can already 2 days in advance. Simply how the cardiovascular system adjusts, you can already start to see this person is going into a septic shock that needs to be treated. These are the things that I think when these platforms come together, it's very, very powerful.
Thank you, Rian. I want to ask you another question from the discussions we've had, from the pictures you've seen, from the people that you've met, and from an ecosystem perspective. What are the potential opportunities that you may have seen here that would you, be it personally or from a LifeQ perspective, do you see any opportunities from a lesvos perspective?
Thanks. So, there's solutions that can be driven for the people, but there's also solutions that can be driven by the people. And that's where I get excited by both. On the one end, I get very excited by the prospect where we can leverage technology platforms like LifeQ, like just normal tech platforms like Amazon, where people can plug in and where the barrier to entry to drive revenue is not that high. So where we can start to engage with the universities here locally towards building solutions. And then you have the solutions for the people, the solutions I just spoke of. And these two worlds don't even need to exist separately. These two worlds can even exist together. And that's when it becomes really, really exciting, because then the ecosystem loop closes in on itself. And that's beautiful. It's where the people locally that understands the problems that exist can help find solutions. And then there's technologies as tools that can be leveraged simply for people to help solve those problems.
And just to add to that, within just the partners we've already met here in the past 3 days, it does actually not need to cost that much to figure out, will this solution help the people in the camps? Would this help the local community? Is there enough, let's say volunteers or, UN or other organizations support to actually carry it out? And also to your point, exactly, like within a week, I think you can really just prototype and test. And things we need, permission to go to the camp, talk to some of the users, have a prototype and actually seeing it in action. And just as to your point, how you built your company, with very little funds, I built my company with my own funds as well. You know how to, if you've ever done that, which, you know, I recommend everyone too, you can do things almost for nothing. Because the first thing you need is proof it works and people want it. And if you can't even prove that for no money, you don't really have a product. And then after you've proven it, then you can show it to the different groups. And money, you can find money, because if your solution is being done, whatever problem you're addressing is being done and it costs more right now, then obviously whatever funding that's going to solve that problem will go to you instead. And that's how, you know, money works, period. So that's, you know, another thing that's just really exciting about the collaboration that we're having here.
The domino curve needs to make sense ultimately, and that can be calculated.
Collaboration all the way. That's absolutely excellent to hear from both of you. Thank you. Boris, hearing from the colleagues and just on some of the points that have been mentioned, what are your thoughts?
Well, I was thinking of some of the tech that we've been using as an agency, and over the past few years, obviously, we're always looking at ways to become more efficient, to deliver to more people, and to save money, because we need to be credible as an agency. We need to have our integrity. We need to be accountable with our donors. And obviously, technology steps in and has been stepping in for many years, but now is very tangible in everything that we do. So we're using platforms that are used widely on a daily basis by anyone. For instance, much of the coordination that has been done in Europe with volunteers, with national and international NGOs, even with authorities on some occasions, but not that much, is through WhatsApp. So even today, I'm on 27 WhatsApp groups and finding out what's happening in Attica and north of Lesvos, whether somebody is receiving treatment in the hospital, and so forth. So we're using readily available tech, but we're also doing specific solutions. For instance, I'm thinking of cash assistance, something which is a global priority for UNHCR. We've just started to roll out a cash program here, which gives people the opportunity to be self-reliant, not having to wait for an in-kind donation or a food distribution. They can buy whatever they need. Obviously, they're not going to be getting a salary of a European bureaucrat in Brussels, for instance, but they will have something which will make their lives more suitable for themselves, and they will feel empowered. So empowerment, certainly one of the driving factors that we're looking at when we look at tech solutions. So in Lebanon, what do we do? Because in Lebanon there are 600,000 Syrian refugees, so it's a huge population, and fraud is one of the things that we always need to look at, especially when you're rolling out a huge cash program. Physical verifications needed to be done every single month. So before you top up the card, you needed to make sure that that person was still there, that their situation hadn't changed, and before you make the decision that they will be getting cash assistance. For such a huge population, you can imagine the resources that need to go in terms of staffing, in terms of day-to-day expenses. So that was resolved by introducing iris scans, which took away the need for a card altogether. But going through something which obviously is affecting a huge population, and it's thankfully successful, but an incredibly big program, to something as simple as a translation card. This is something that we did in Fyrom, in the former Yugoslav Republic of Macedonia last year. And we did it because from the hundreds of thousands of people that were moving through the country, most didn't speak Macedonian. Certainly a few of them spoke fluent English. Many of them spoke Arabic, Farsi, and French, and other languages. So we never had the luxury of having 10 interpreters from 10 different languages readily available at any given time. So what we did with Translators Without Borders, with Mercy Corps, we came up with an app that was driven because of the need of the people. It was tested with the people, and it was done with the support of and the full involvement of the humanitarian community.
At Fyrom, in
Fyrom. So both UNHCR and Mercy Corps obviously being providers of humanitarian support. And it was a very simple app with a card that gave you a basic translation of, you go through a menu, you select what the issue is, what the most likely response would be, and you play it through a loudspeaker, and you connect your phone to the loudspeaker through the microphone jack. So, and that was a great, very simple and great solution, easy to roll out with the staff. You don't need much training, more than 2 minutes to navigate the interface. So we're always looking at these types of solutions. Connectivity, for instance. You know, one of the things that, and I've had the incredible experience of being on the shoreline and working with the volunteers when boats were arriving. So in a morning of, let's say, Sunday, December 2015, we would have, in a matter of 2-3 hours, 3,000 people coming on 25 boats in the south of Lesvos. The first thing that, well, many of them would collapse, exhausted or in shock. They would need urgent medical support. But those that felt fine, the first thing they would say is, where do I get Wi-Fi? So connectivity, charging stations. These were things that really helped far more than, in many ways, the distribution of hygiene items. So yes, tech is a part of all of our lives, and certainly in the humanitarian world, it is making a difference in what money we're spending to help in the most appropriate way. Okay? Yeah.
Okay, what I found very interesting, Daniel, just 1 second, is that, so that something was implemented in Firom, that in Jordan that you had one, and then you said the cash card here. So I'm asking, you know, and from a digital identity, from be it health, be it fintech, the question is, or educational tech solutions, right? How does the community, how can the community engage with you? And so, and I would like to have a better understanding of how they were implemented in those areas. And so the next question would be, for all people that are interested in working with you, is there not a way that we can invite social entrepreneurs as well to come to Lesvos so that we can work with them? Because also, as we all know, you know, the local people, which is again the doorstep of Europe, but the local people have been very negatively affected by the tourism, which is the main industry. So is there not a way that we could collectively look to invite some of those social entrepreneurs out of season to come and support the locals who've really, you know, been pretty heroic in the last 2 years, given the circumstances? So as a doorstep to Europe, can we not look to invite that? What do we need to invite the social entrepreneurs around the world to come and meet with the people such as yourselves, so that we can have a workshop to see what is out there and how we could potentially explore that? I'm leaving that open to either one of you to
First, and I'm speaking for myself right now, Lesvos is the most incredible place in the world, and the people of Lesvos have shown the whole world what it means to show solidarity and to be empathetic and to really show what humanity can be. At times, recently, we've seen the darker side of humanity. We've seen wars that have only intensified and multiplied. We've seen a population of 65 million displaced because of persecution and war. And we've seen tiny Lesvos with a population of 90,000 people showing that they can welcome 600,000. So an extraordinary place, just to mention that. So as you said, heroic. Yes, the people of Lesvos are heroic, and they have been. And certainly the impact of the emergency, and now in the post-emergency phase, is very evident. Luckily, I understand that there is some rebound in the tourist industry this season, but last year in Petra and Molivos, tourism was down 90%. So certainly working with the host community is essential, and it's a priority for UNHCR as well. Some of the most significant projects that we've been rolling out in the past months, in fact, are helping the village of Moria, Skala Sikamnia, trying to work more and more with the local community. And one of our priorities is also bringing the two communities together, the local community and the refugee community, now in a different context. So before they would interact in this very transient manner, a matter of hours, maybe a day or two as people were coming through, and then they would leave, and then the next day you would have a new group of 10,000 people. Now it's a different situation where you have a more static, more stable population. Now, how do you access the people in the sites, for instance, or in our accommodation scheme in the urban, in apartments, hotels, and whatnot? We have a very interesting approach to our programming. We call it, and I hate getting technical, but I think that just because it has a name, it's called the participatory assessment. Something which used to be called age, gender, and diversity mainstreaming. And the whole process and the whole philosophy is, let's get as many of the people that are providing services, so the authorities, the local NGOs, the international NGOs, the volunteers, let's form multifunctional teams, and let's go out and in focus groups talk to Somali women between 30 and 40, or unaccompanied children from Afghanistan. Different age groups, different perspectives, different challenges, and let's hear from them, what are they facing, what are their needs. So that is quite an open process, and it's also, the results of it can be shared widely, but also the questions that we ask, the questionnaires that we develop, that can also be informed by CSR, for instance, or other perspectives. So we're always looking for a more inclusive, it's the humanitarian support globally, and I think this is becoming even more true, and certainly for Lesvos with several thousand volunteers coming and assisting directly, it's opening up more. And it is becoming more inclusive because of the need to be more responsible. So we would be open, and I speak for our team without consulting, but we would certainly be open to a consultation in involving others, certainly the university. We've actually involved the university in a number of initiatives. We're working now on a language program. So language training for refugees in a number of languages. We're doing it on Lesvos, on Samos, and in other locations as well. So we are open to that interaction, certainly.
Then one quick question. Please go ahead.
Can I directly react? You make me smile again because exactly what you said we have discussed in for example, in the ecosystem panel, multi-stakeholders, interdisciplinary teams, multiple viewpoints, and this is really interesting to hear. And I want to thank him because he almost asked a question that I wanted to ask you. But let me ask a little bit more towards you said that a co-creation space, a common space would be very much in your interest, something that the Changemakers Lab is trying now to establish. Could you tell us from your perspective what would be the added value to make your work more effective? What would be the key ingredients that would make it very valuable for you?
Well, my initial and immediate reaction is self-reliance. So this no longer transient population may stay for extended lengths of time until the situation improves in their country of origin, or until some of them are found that they cannot stay legally and they must return to their country of origin or to Turkey or elsewhere. But some will stay as recognized refugees. So building up their skill set early on, and don't think that I mean that they lack skills. On the contrary. Go to Karatepet today and I'm sure that you'll find a dentist, an engineer, a teacher, and a baker, for sure. And be sure that they made their living quite well, and they would have been very content and happy to continue doing so if they hadn't been displaced forcibly. So, but how do you bring them into this new reality? Because perhaps being a baker in Aleppo is not the same as being a baker in Mytilene. How do you they would obviously need language skills. They would need some type of literacy that they might not have had at that time, or perhaps it was the same but in a different context, so they would need to adapt to using a new technology, for instance, or understanding the fiscal system, which they'll need to apply if they're an entrepreneur in Greece. So I would say the added value would be recognize early on talent and try to build it, and this gives the incentive, even if they do go back in a year or in 2 months, they will continue their development. And once again, bringing back to the moment of lifelong learning. So one of the issues that we're having right now, for instance, on Lesvos and other islands is you have in the whole of Greece about 7,000 refugee and migrant children. And while about 2,500 of them, and these are school-aged children, 2,500 of them are already enrolled in formal education, that's mostly on the mainland. There are only a handful of people, children that are enrolled in formal education on the islands. And it has to do with the legal system, but it means that they have been disconnected from a natural process that should be continuous. So how do you rebuild that link? How do you help restore a sense of normality? How do you bring children back into the classroom? If you can't do it formally, you look for non-formal opportunities. So certainly tech, coding, co-work spaces, these are things that could help that process forward.
Excellent. Thank you very much, Boris. And I also want to mention that with SAP, the Refugee Code Week, where we have been in contact with them and they are interested in coming to Lesvos as well. So it would be great to tie in with yourselves, of course, at the university and see how we could bring more stakeholders to be involved with it. I'm going to give 30 seconds to each person just to wrap up. But I would like for yourself, Boris, if you could comment on like what really has stood out for me, UNHCR, how you have been managing all the stakeholders, the different NGOs. I think the Thursday meetings that I've attended, some of them, it's been personally incredible. And then also from Karate Pes perspective, the way that camp has been managed and handled, like you walk in there, and I think most people are quite surprised, and from handling it as a hospitality center with guests. So if from that context, if you could say just a few words, and then the rest of everyone else just to close up on that.
Okay, well, thank you. Well, first of all, to say that UNHCR, the UN Refugee Agency, manages only our own capacity and resources. So we're in no terms a managing agency for anyone else. We're a very inclusive agency. Now, our role, we've been in Greece for 65 years. This was one of the first offices that we opened in Athens, not on Lesvos, in 1952. So we've been here throughout these 65 years, and we will continue to be in Greece. But what happened is we had a blip in the system in 2015, 2016, when an exceptional situation happened. So we expanded, and we weren't the only ones that expanded. You had a plethora of international, national organizations, volunteers and whatnot, but all of us here for the benefit of refugees and migrants, but to support the Greek government. So all that we do is in support of the Greek government. We're here at the invitation of the government. We're not here to substitute. In fact, we're here to help build the capacity, and through the experience that we have of 7 decades of work around the world for refugees, to help the Greek government through this difficult but manageable now situation. So with that perspective, we have tried to help the authorities build a coordination structure. It was difficult initially when we started to deploy our teams in October, November 2015, because we had the volunteer groups here before us, and they felt that we had come in a bit late, which wasn't necessarily the case, because we were throughout the process following what was happening and taking decisions of how we could react and when was the appropriate time to do so, and we couldn't do it before the EU and Greece invited us to do it. So that is when we started to invest in coordination. That would be usually one of the first steps when we go into an emergency situation. So we have what you mentioned, the coordination meeting, formerly known as the Interagency Consultation Forum, every morning, every Thursday morning. And it's a very inclusive platform where we try to bring everyone together and look at what are the main issues, challenges, and gaps that we can address together without duplication, without overlapping. And we also have thematic meetings. Some are weekly, some are bi-weekly, some are monthly, and they address protection, health, shelter, water and sanitation, hygiene, communicating directly with communities through information platforms, shoreline response, Search and rescue, we've actually helped the search and rescue teams come together and coordinate. So these are important processes because they give the opportunity to deliver as one. So that delivery otherwise is hindered by, again, a lot of the organizations that came in had never had the experience of joining a humanitarian response. So many of them actually built themselves as organizations here on the island, and some of them have become fantastic organizations that have gone abroad or have stayed in Greece but beyond Lesvos. However, without having that knowledge, that experience, they would go and overlap and duplicate and not be necessarily efficient from the beginning. So sharing that experience, ushering them through. If we can, the moment that we can disengage is the moment that we're happiest, because then we can focus on South Sudan, where we're needed more right now. And so for us, building capacity is essential.
Thank you very much, Boris. Daniel, I'm not sure, I see you nodding. Is that like a yes for a hackathon on that coordination meeting where all the challenges are? Or just if you can just wrap up for 30 seconds.
Let's maybe go first and let me think about it.
Okay. A small wrap up so we can close. Any final thoughts from either of your side?
Yeah, no, I'm just excited to engage around, the first thing that I want to do around solutions for the people to save cost and things like that is to really start churning the numbers with other ecosystem partners, and then Vasily to directly engage with you and people like Daniel to say, like, how do we create this space? How do we plug that space as it is, as solutions develop? How do we plug it in immediately into the broader technology ecosystem? So those are, I think, the action points that I see from my perspective.
And I think Lesvos presents a really unique opportunity in the sense that at the end of the day, what we are doing is capacity building, building skills for the refugees so that they can live a full life when they are done with the transition phase, or even during, and enhancing the capacity within the local area. And I can see it as a model where if it can work in Lesvos, which is not a main city, and it's got, not as much funding in the city, but if it can work here, it can work anywhere else. If you look at where rebuilding needs to happen, Syria, Iraq, and all of these places, it's the same type of effort that needs to happen to rebuild those countries. So if we can build a model in a very controlled manner with very passionate collaborators like everyone here, we can actually showcase it as the model to replicate elsewhere.
Thank you, Ting. Thank you very much for that. Daniel?
Having tried now to digest in with 60 seconds all what Boris said and what you then brought in game of a hackathon, this is certainly an idea to look in how can one learn from all what happened, all what went well, all what could be improved, with all the limitations that I think everybody understands. There are different forms of organizations, different forms of structures, which have all their advantages and disadvantages. So if it's a hackathon, a right format to try to have a better preparedness, even better preparedness for future, or if it's another format, I think this is too early to say, but I'm very interested to sit together with this entire ecosystem and discuss in which form we can learn from all this and have a better preparedness for whatever crisis comes around the world.
I will first need to go to Refugee Code Week and learn how to code. Can I just say something, because we should also recognize that today is Europe Day. It's also, I've Googled and I found out on Wikipedia that it's Billy Joel's birthday. So my wrap-up would be, quoting Billy Joel off of Wikipedia, "The good old days weren't always good, and tomorrow ain't as bad as it seems."